Hello, my name is Mariela Santamaria. I'm a sophomore and I'm going to be presenting on child obesity. So, child obesity is a public health problem, and this problem exists in society because only 1% to about 3% of society eats the recommended food from each section of the food pyramid. So, this means that the remaining 97% of the population is not receiving the necessary nutrients that they need to be healthy. Foods that are commonly ignored are vegetables such as lettuce, potatoes, and tomatoes. So, the reason that childhood obesity is prevalent is due to lack of exercise. So, nowadays, children are more inactive and they rather play video games, such as this image depicts, or be on electronic devices than be active outdoors. Another common factor is poor eating habits, which can result due to genetic factors. So, children with a family history are more likely to be obese due to eating habits within the family. So, public health problem continued. So, child obesity is more prevalent in ethnic minority neighborhoods. And the reason for this is because fast foods are more prominent within these neighborhoods. As depicted in this image, you can see McDonald's, Taco Bell, Pizza Hut in the background. So, fast foods are easy for busy working parents to resort to because it is inexpensive. However, it does contain high calories and low nutritional value. And then schools are another main reason where obesity is common. And the reason for this is because schools contain vending machines with soda and junk food. And then schools are also being less strict on children's physical requirements. For example, 87% of schools used to require physical education in 8th grade, and now only 47% required in 10th grade and only 20% required in grade 12. And then another common area where child obesity is prevalent are in suburbs because people rely too much on cars. They use cars even to walk to get some milk from the market when they can simply walk there. So, risks of childhood obesity in their future is increased risk of adult obesity, and this leads to heart disease and type 2 diabetes or cancer. So, etiological factors are that children 6 to 11 years of age and adolescents 12 to 17 years of age are more commonly to have this disease, and it is more prevalent within African Americans, Mexicans, and Native Americans. And then child obesity is related to financial stability and location of communities within these races. So, how to solve the problem? So, the first strategy is to encourage better eating habits. So, parents can expose their children to healthier food options, and these food options may include fruits, vegetables, whole grain products, low fat dairy products, lean meats, poultry, fish, lentils, and beans for protein. They may also encourage the drinking of water and limit sugar sweetened beverages, sugar, sodium, and saturated fat. So, the second strategy is to help kids stay active. So, kids are supposed to exercise for a minimum of about 60 minutes per day. And these type of exercises that they can do are simple exercises such as walking, or even exercises that may be enjoyable for the child, which can be a game such as playing tag or jump rope, or they can even just play a sport that interests them, such as soccer, swimming, or dancing. So, two cultural examples that have shown a decrease in obesity have been Japan and Europe. And Japan has mainly focused their efforts within school. So their school lunches are planned by a nutritionist, and they include locally grown and fresh ingredients. And their school lunches mainly consist of rice, vegetables, and fish and soup. And their meals are effective and cheap because their plates are only $3 per meal. Another example is in Europe, and they ensure that only healthy foods are sold in schools and preschools, which are the main age groups where obesity is prevalent. And they have controls on food and drinks, advertising on TV, the internet, and in school. They also have mandatory nutritional information labeling that is clear and easy for the consumer to understand. They also have improved training for health professionals so that they are able to recognize and diagnose obesity risks in infancy, childhood, and adolescence. So, public health in the future. According to research from Johns Hopkins University School based intervention can reduce obesity. Interventions are most effective if targeted toward diet and physical activity, and further research does need to be conducted about the effectiveness of targeting other settings rather than just school, or about the effectiveness of targeting certain ethnic groups. In my opinion, paying more attention to children's dietary and active needs is an effective way to reduce child obesity because it is the way in which obesity is caused because children are eating too many unhealthy foods or they're not exercising enough to reduce the calories of these foods. So it is important to focus on these aspects. And it would also be more beneficial for low-income families to have access to inexpensive healthy foods, just like there is sufficient access to unhealthy fast foods.